Hi guys, my name is Ethan and I'm out here in the Atlanta clinic here at Elite Body Sculpture. We have a wonderful patient. Her name is Michaela and she's getting a full abdomen done today. We want to show you guys a little bit of that process and what that looks like. So I'm going to walk in here with Dr. D and we're going to go through it. It sounds good? Let's go. All right, hi everybody. Hi. How's everyone doing? Hi Michaela. How are you doing?
Good.
Oh, I'm so glad. So Michaela here, just for everyone to hear again. We're out at the Atlanta clinic with Michaela and she's getting a full abdomen with Dr. D here. Hi Dr. D.
Hi.
How are you doing?
I'm wonderful today.
Yay, I'm glad. Well, Michaela, we have some fun little questions for you. Are you ready for questions? Awesome. Okay. So, first question. What areas are you getting treated today?
So I'm getting my full abdomen done today.
Full abdomen?
Yes.
Awesome. There we go. So full abdomen, sorry, we lost connection there. Full abdomen is the upper, lower abdomen and the side, the waist. So perfect. So why did you want to get this procedure?
So I just wanted to get it because I'm starting a new chapter in life after graduating from undergrad and doing my master's as well. And I just wanted to just jump into a new chapter healthier and just kind of new me, you know.
Find a new you. That's awesome. Was there anything like specific that came up in your life that wanted you to get it? Or you talked a little bit about college, right?
Yeah, just college, and like college was like a lot of stress. So it's kind of like a gift to myself for like, you know, getting all through it. So
Yay. I'm so glad. Well, we love to, here at Elite Body Sculpture, we love to market that this is a great health Kickstarter for guys, for everybody. So I think that's a great thing for you. And I'm so happy that you came with us. So as far as like prior to this procedure and stuff, did you like to work out? Did you eat healthy? How did you usually?
I did. So the only thing, like I grew up playing basketball. I grew up very active. So
Oh, she's an athlete. Okay, yeah.
I was always active, and then when I got to college, it kind of like took a hold on that, and then that's where I kind of gained like a whole bunch of weight and just with stress. So like I love going to the gym. I love working out, but you know, I just wanted to kind of just kickstart my journey.
Yes. Well, that's so great. So moving forward here in the future after getting AirSculpt, do you have any fun events coming up that you plan on doing or?
Yes, well, of course, since COVID, like a lot of my plans for traveling got postponed. So
Right.
all 2022, I plan to be stamping my passport book. So
Yes, you're gonna get out to Europe, aren't you?
yes, definitely.
Heck yeah, we're gonna go to Italy. We're gonna get that swimsuit on, right?
Yes, we finished.
Yes. And not just a swimsuit. Let's make everyone know. A two-piece, girl.
Or maybe the nude beaches.
Okay,
right?
yeah, okay. So she's really getting out there. We love that. Okay, so great. You were kind of answering some of those questions, but you're most excited about those Europe trip. You want to get out, that new health Kickstarter for you. That's amazing. So you're getting your full abdomen done. Is there any specific that you wanted to work on with your full abdomen and why you wanted to get your full abdomen done?
So I'm always like had problem with my love handles, so that's really like why I targeted my full abdomen and just like around my belly too, just like I said, to have a easy like push start, kick start to going ahead and being in the gym and working hard and just eating healthier as well.
Yeah, that's awesome. Well, thank you so much, Michaela, for those questions. Dr. D, do you want to continue here doing some AirSculpt? We can show a little bit of what's happening back here. Sorry, we had her stop there so we could hear Michaela, but here, Michaela, she's totally fine. Yeah. Michaela, are you feeling any pain
with
this?
It's kind of, honestly, it's like a tickling, vibrating motion, and I'm like really ticklish, so I'm like just trying not to,
not to laugh.
Yeah.
Well, Michaela, I know we already have a little bit here. Have some fat right here, and then I know we got some over here. How many liters are we at right now, Dr. D?
We are just a little over 3 liters.
Over 3 liters. That's crazy. I like to think about it like it's like those big 2-liter pops or whatever, and like how much that is.
Coca-Cola.
Heck yeah, you got a Coca-Cola out of you, girl.
Yeah, to get a Coca-Cola body.
Yes, we love that. Yes. Okay, so I have some questions for the doctor here.
Okay.
Dr. D, how is our patient doing so far?
The patient's doing very, very well, very comfortable throughout the procedure. It's completely outpatient. She'll go home and tomorrow resume all normal activities.
Awesome. And then how much we've already talked about this, but we talked about you've done 3 liters of fat so far. So have you hit most of her body, or where are you at?
We've done the abdomen, and we're working on this waist, and we'll do the other side in a minute.
Perfect. And then how much fat can you take out with AirSculpt?
So typically we have a limit of 5 liters of total, what we call lipoaspirate, or a total of what's removed.
Got it. Perfect. And then you personally, why do you like doing AirSculpt over other procedures?
So the AirSculpt cannula vibrates at a very, very high rate of speed, and that removes the fat in a much gentler fashion than traditional liposuction. And that results in less bruising, less swelling, less pain, faster recovery for our patients.
That's awesome. And then I know so some of the live questions we're getting here is everyone's asking how Michaela's doing. Michaela, you just answered that a little earlier ago, but you still doing good?
I'm still doing good, yeah.
She's awake and everything, everybody. This is a painless. Yeah, she's painless. She was talking about how she was laughing from the procedure and it tickled her. Very easy. Little bit. Look at her laugh over there. Michaela, stop being so cute. So I have another question. So, Doc, will you explain exactly what AirSculpt is in general?
So AirSculpt uses a patented technology and a special handpiece and cannula to remove the fat in a much more gentler fashion than traditional liposuction.
Perfect. And then let's go over, so I see some other questions coming in here. What's a typical recovery look like for someone who just had AirSculpt?
So a typical recovery, and everyone recovers slightly different, but most people are up and back to normal activity the next day. They do experience some soreness, they do experience bruising and swelling, and that really starts to go away after the first 2 weeks and continues to go away for the next 4 to 6 weeks.
Perfect. And then best results, when do you usually see those at?
The best results, you start to see results as early as 2 weeks.
2 weeks,
and
cool.
You'll continue to see results even up to 6 months to a year after your procedure.
6 months and a year. Love that. All right, let me see some other questions I'm getting here. So if, let's say, a client is traveling, or patient flying in, when can they travel back?
So they can usually travel back the next day. Not the same day, but usually the next day.
Perfect. Okay, I'm seeing some questions coming in. Does it leave scars?
So our little access points do leave a little scar. It looks like a little freckle when it heals. They're usually very, very small.
Yeah. So something that you wouldn't probably notice later on. Once it heals.
No, most patients heal without any trouble whatsoever.
It looks like just like any other freckle. Let's see here. How soon can we go back to work, and is this permanent? So we kind of answered some of those questions, but if you want to answer again, how soon can someone go back to work usually?
Yes, some people go back to work the next day. Some people do the procedure on Thursday, Friday, go back on a Monday.
Yeah.
It really just depends on the type of job that you do and the procedure that you have.
And then is this a permanent procedure?
So once the fat is removed, it's gone permanently.
Fat is gone forever. Michaela, did you hear that?
I am so excited.
Yes, she's excited.
Bye.
Permanent. We love that.
Loving it.
Do we have any BMI requirements here?
So there really is no BMI requirement for the procedure. However, the procedure, the results are dependent on 3 things, not just AirSculpt, but also diet and exercise.
Yep.
So if you really want to get the best results for any body contouring procedure, you're going to have to follow diet, exercise, as well as the AirSculpt.
So getting AirSculpt done also leads into you got to continue a healthy lifestyle.
Continue the healthy lifestyle.
That gets you those best results.
That's right.
Absolutely. Okay, let's see here. So someone asked, can I get like my legs done and my abdomen done the same day?
Yes.
Is that
have.
typical?
Mm-hmm.
So you can get multiple areas done in the same day, depending on the person and how much fat there,
So
correct?
It really depends on your size and how much lidocaine or the numbing medication that we give. We are limited by your weight as to how much a safe level is.
Okay, there we go. Sorry, everyone, we're back. What was that last part again?
Did they
Say that.
catch you? Okay.
Sorry, yeah.
So the question was multiple areas and kind of what are the limitations for multiple areas. It's really based on your weight. The numbing solution uses a medication called lidocaine. Many people have had that at the dentist. But there are certain levels that can become toxic, and that's based on your weight. So the amount of lidocaine we need for your procedure is really the rate limiting step to how many areas you can get.
Perfect. And then someone asked about massages. Is that required with AirSculpt?
So with AirSculpt, massages are not required.
Perfect.
Massages are usually used when you have a lot of scar tissue that's formed after a procedure. That's more typically seen with traditional liposuction, which is much more aggressive motion of our hand. The newer technologies with massages aren't necessary because we don't see the same level of scar tissue.
Perfect. And then, did we have any other questions here? No more questions. Okay, well, I think that's about it for everybody. Thank you again, everyone, for watching. Thank you, Dr. D, for answering our questions here today. And thank you, Michaela, for giving us all those fun questions and being our little test patient here. We really appreciate it. All right, we're going to head out, but I'm going to let you guys get to it. Do we want to give a little wave goodbye before we head out? We have a DM team that's on our DMs 24/7, so please send us any questions. We'll get to you as soon as possible. Thank you so much. Goodbye.